Hi guys, I'm sorry I couldn't make it out there. I really wanted to get out there, but more importantly, you guys are here today. I'm so grateful to have this time with you. If you can start from the beginning with just telling us a little bit about you and from beginning to end your story, and I'm sure that's going to lead right into us meeting Judy in episode 3, chapter 4.
Okay. My name is Amy. I'm a 45-year-old breast cancer survivor. uh, I've had 2 diagnoses. The first one was in 2018 for invasive ductal carcinoma, stage 2. We went through the whole gamut of chemo and double mastectomy, radiation, and we were declared no evidence of disease. But that only lasted about 14 months. So I went back in just for a regular checkup. They typically were, checkups for me after no evidence of disease or just blood work usually. And so I went in and said, hey, I have a lump in my leg, which is odd, had nothing to do with my breasts, but it's new and it's different. It's tender. If I push on it, could that be anything related? And their answer was no, but we'll check it out. So they did a scan and I lit up just shoulder to shoulder, bottom of the rib cage to the neck, just all throughout. So they tested again, and this time I came back as triple negative breast cancer. I'm still in the fight, but the good thing is today I am considered cancer-free. I am still taking chemo, but that's a hot topic of discussion, something I think will be stopping very soon, hopefully. Got to get my head in the right space to take that leap of faith, but I think I'm there. I think I'm close. So that's what I'm working on right now.
So what year were you first diagnosed and how long has it been since then?
First diagnosed in 2018. It's been three years. Yeah, December. So yeah, 3 years.
Okay, and when did you exactly started the treatment of the RSO oil from preventative maintenance health?
So I reached out to you guys in September of 2020. That was when our second diagnosis came to be. And at that point, they were calling it stage 4. They actually gave me about 18 months to live. And so I said, I'm pulling out all the stops. I'm going to do whatever it takes to beat this. We started probably early October taking the RSO.
You were doing chemo at that exact time or no?
I started the RSO maybe a week before I started back into taking some chemo. It was actually an immunotherapy combination with a chemo, but in the course of about 6 weeks, they were continuing to run tests and I had some progression. So they stopped that chemo and sent me back to my original oncologist to continue treatment. And when I got to him, things were pretty far down, down the path. I was not able to walk well. They had to wheel me in a wheelchair. I had to have oxygen, to breathe through my nose just all the time. But when he got me back, he said, we're going to turn this around. We got a couple of blood transfusions, a couple of medications, and then he got me going on chemo again. However, come February for my next scan, there was nothing there. His goal was to stop whatever was happening, to keep it from growing. And I continued taking the RSO. And when he did the next scan, there was absolutely nothing. I was clear. So he was completely baffled and amazed and excited. He didn't know what to think of it. Because he didn't know what to think of it, his recommendation was, let's keep going with chemo. We need to keep our foot on its throat while it's down. I agreed at the time out of fear. I'm expecting him to be the expert, telling me about that health. But the more that I read and the more that we talk, the more that I try the RSO and keep up with that, I'm still clear today. So it's amazing. It really is.
What a turnaround. And I'm happy I had the opportunity and my right foot forward in trying to make this happen for you. So you stood consistent and this ended up working. Of course, the doctor couldn't say anything because he doesn't know what I knew from experience. And I was telling you I have a number of patients that had this particular experience, and it's because there's a synergy between chemo and the cannabis oil. It ended up working out. I knew that it would involve, and it could involve, using chemotherapy in conjunction with it. So Judy, please, you have the microphone.
Sure, thank you. I was diagnosed December 2020 with stage 4 ovarian primary peritoneal cancer, which means it started in the ovaries. However, the reason it's peritoneal is because it now has left, the tumors left the ovaries and went to the other space within my pelvis. So I had no idea. I went to the hospital thinking that I had appendicitis, and a few days later I came out with stage 4 cancer, had no clue, didn't have a doctor, didn't have anything except a diagnosis. So I stayed in the hospital a couple of days longer than usual to have my pity party. And after I had my little 2-day pity party, I said, that's enough of that. There's no more of that. And if I ask God to heal me, the least I can do is work for it. So I started going 90 miles an hour on the internet, and I start looking into alternative medicines, including the holistic. And I get a call one evening from this wonderful friend that I have, and he said, Judy, I have just talked with a guy that I work with, and he showed me the most wonderful scan that had nothing on it. And it turned out, of course, it was Amy, his wife. This was Jamie, and it was Amy's wife, that he was showing my friend the non-scan, and told the story of her being, like the story she told, she had nothing. She just was cured. And I'm thinking, I have no idea what RSO is. I never heard of it, but I'm going to figure it out pretty quickly. So Amy and Jamie were wonderful. They called me, talked me through it, because the first thing you want to think is, number one, this can't be for real, because nobody, it's a story that's made up that you read on the internet. However, they convinced me it was real, and they were kind enough to facilitate my being able to try the product. I immediately did. It was sometime in March, maybe the middle of March or whatever, because I had surgery coming up April the 12th, and my surgery was to basically do exploratory. After they've done 3 chemos, then they want to go in and do exploratory and remove, they call it debulking, remove the cancer that's left from the chemo, or they burn it off or scrape it or whatever they do to get you to NED, no evidence of disease. Well, I had seen my scans. I know the first surgeon that did some work on me told me there were 1,000 BB size little cancers in my pelvic area. And that didn't include the other things that were everywhere. So I expected the worst, although I had enough faith that somehow God had promised me what he would do. And I had done my work, or at least I thought I had put my best foot forward and prayed about it. Well, he did the surgery, the doctor did, and he was expecting a lot because he had cut me as long as he could possibly make the scar. And when he got in there, there was nothing. It was clean, clear, zero, nada, nothing. And he told me personally, I didn't know what to do.
Yeah.
When I got in the operating room and there was nothing there. Of course, they did the hysterectomy. But so then he goes out to see my husband and son. And he would like to brag on the chemo, but he didn't get by with it. And he knew he wasn't going to get by with it because I had already told him what I was doing. What he said to the boy, to my son and husband, was he started out with, the chemo really worked, and then he backed up. He said, well, we kind of both all know that it wasn't just the chemo, wasn't. He said, so since then, I have had no evidence of disease. However, as the protocols are, the cancer community doctors, hospitals, they want you to do as many chemos as they possibly can get you to do. Well, I was scheduled for 3 going forward. I did 2, and I made a decision that I'm not doing anymore, that I'm relying on what I know is going to work. Why would I kill myself intentionally if I'm asking God to heal me, right?
Yes.
Okay. So that's where I am now. So I intend to take the oil as long as I have access to it, and thank God for it.
Yes.
And thank you and thank you for bringing me to where I am right now.
Well, thank you, and you're very welcome. I'm glad I was able to be in such a position to help you. That's why I'm on this mission. I want to try to help and save as many people as possible, and I'm grateful just for the opportunity. Real quick, the doctor gave you how long to live?
He gave me 4 to 6 months to live back in December. And of course, they would like to say, oh, you need to continue taking this chemo and you need to take maintenance drugs. But from my reading, and I've done a lot of reading, it doesn't kill. This chemo doesn't do anything but just kill the top layer. It may decrease the size of the tumor or whatever. But it's like when you cut your yard, you get the top layer and you've got a nice cut on the yard, but the roots are still there. If anybody ever really wants to truly cure cancer, then number one, there's cures out there already. But if they concentrate on the stem cell and kill the stem cell, it's not going to come back, right? Well, what I'm taking with chemo, what you're taking, it's not killing the stem cell. All it's doing is just making you believe that you're buying a little time before it comes back.
The one thing is that we do know is that there's a synergy between the two. So even though we're not a big fan of it, it was necessary, and the capability
right.
of the oil to manipulate it in an all natural fashion, which I believe was the icing on the cake. I would have never figured that out if it wasn't for one of my first stage 4 breast cancer survivor patients, and it was her doctor specifically that said that, and that's when I started learning from there on out. So we have options. We always want to have options in life. So we're going to continue to take this preventative maintenance of the oil and continue to get ourselves checked every 30 or 60 days. And God forbid, if worst case scenario ever happened, you know what worked and what we could go back to. You know, yeah, we're not a fan of it, but now that we're moving forward, you guys seem like that everything is going to be great from here on out.
Thank you.
Thank you. Absolutely.
So I really want to thank you guys for having the time today. Let's keep planning to meet and try to help other people.
You bet.
Absolutely. Yeah.
Thank you so very much.
Yeah.